You know that feeling.
Okay.
You're a bit under the weather, maybe it's a cough, maybe just feeling generally rough, and your brain just starts ticking through
Oh,
possibilities.
yeah, the internal medical detective.
Exactly. Well, today we're focusing that detective lens on one specific culprit, Klebsiella. It might not be a household name, but it's behind some surprisingly common and sometimes pretty serious infections. Understanding it is really quite important.
It really is. And for this deep dive, we're working from some excellent revision notes, really concise stuff.
Good. High yield.
Exactly. Think of this as your rapid review, hitting the absolute essentials of Klebsiella infections. The aim here is that by the end, you don't just know about it, you actually, get what makes it tick, how it affects people.
Okay, sounds good. So Klebsiella, in a nutshell, what are we talking about?
Well, Klebsiella, it's a group of bacteria. They're classed as gram-negative.
Right, the gram stain thing.
Yeah, it refers to their cell wall structure, which, impacts how some antibiotics work against them. The main one we usually deal with is Klebsiella pneumonia.
Okay.
And what's kind of interesting is its ubiquitous presence. That means it's basically everywhere in the environment, like soil and water, but also, and this surprises some people, it can be part of the normal bacteria living in our digestive system.
So it can just be hanging out inside us, not causing any trouble.
Precisely. Most of the time it is. But the issue is Klebsiella has a really broad infection spectrum,
Meaning,
meaning it can cause a whole range of problems from things like, fairly common urinary tract infections, UTIs, right up to quite severe stuff like pneumonia or bloodstream infections. So it's really about when and where it starts causing trouble.
right. Okay, so how does this bug that's sometimes just, well, there, turn into something serious?
Yeah.
Let's talk about the causes, the etiology, and how it actually spreads.
Sure. So like I said, Klebsiella pneumonia is the main player, though you do sometimes see other Klebsiella species involved. Transmission, it can happen through direct contact with someone who's infected
Okay.
or by touching surfaces that are contaminated. But a really key route, especially for the more serious infections, is within healthcare settings.
Oh, hospitals, care homes.
Exactly. Hospitals, long-term care facilities, things like contaminated medical devices, catheters are a big one, and just the general hospital environment can be sources.
Yeah, that makes sense, especially devices that kind of bypass the body's natural barriers. Now, the notes also mentioned antibiotic resistance. That's a huge topic these days, isn't it?
Oh, absolutely massive. Some strains of Klebsiella pneumonia, they've developed resistance to lots of different antibiotics. It's like they've learned how to disable our weapons against them.
Wow.
And that makes treating these infections incredibly challenging. It's a major global health concern.
Definitely something to be very aware of. So who's most likely to run into trouble with these infections? What are the risk factors?
Yeah, there are several things that increase a person's risk. Advanced age is one. Older people often just have a less powerful immune response.
Okay.
Underlying chronic conditions are also really significant. Diabetes and liver disease are classic examples mentioned in the notes. And of course, anyone with a compromised immune system, for whatever reason, is going to be more susceptible.
Right. So older age, weaker immune systems, chronic illnesses.
Yeah.
What else puts people at risk?
Well, long stays in hospital or in long-term care, that links right back to the healthcare-associated spread we just talked about.
Gotcha.
Recent surgery or any kind of invasive medical procedure can also up the risk, basically creating an entry point for the bacteria.
Makes sense.
And finally, the use of those invasive medical devices, we mentioned things like urinary catheters, ventilators, those are really well-known risk factors. Anything that weakens your defenses or gives the bacteria an in.
That paints a pretty clear picture of vulnerability. Okay, let's get into the mechanism. How does Klebsiella actually do its damage? The pathophysiology.
Right. So Klebsiella has what we call virulence factors. Think of them as its weapons or tools for causing disease.
Okay.
A really important one is its capsule polysaccharides. It's this thick, slimy outer layer. You can almost imagine it like a cloaking device.
Oh, okay.
It helps the bacteria hide from our immune system, stops it getting engulfed and destroyed. They also produce various enzymes which can directly damage our tissues. They're not just passively sitting there.
So they're actively fighting back and causing harm.
Exactly. The whole process starts with the bacteria getting past our initial defenses. Then they set up shop, they colonize a vulnerable area, maybe the lungs, maybe the urinary tract. Once they're established, they multiply, cause local problems, local symptoms.
And then sometimes it spreads.
Yes. In more serious cases, they can get into the bloodstream and spread throughout the body. That leads to systemic disease like sepsis.
Okay. So If someone presents with symptoms that could be Klebsiella, what else are clinicians thinking about? What's on the differential diagnosis list?
Yeah, that's always a key step, isn't it? Ruling things out. So for pneumonia, which Klebsiella can cause quite severely, doctors would also consider other bacterial pneumonias like strep pneumoviral pneumonias, maybe even fungal infections, though less common.
And for something like a UTI?
For urinary tract infection, the differential would definitely include other common bacteria that cause UTIs, like E. coli. Occasionally, fungal UTIs too. The whole point is to consider all the likely candidates before confirming it's Klebsiella.
Right, don't jump to conclusions.
Yeah.
Okay, what about the bigger picture? Who gets these infections? Where do we see them most? The epidemiology.
Well, the epidemiology really points strongly towards healthcare settings. These infections are far more common in hospitals and long-term care facilities compared to out in the community.
So it's primarily a healthcare-associated infection then?
Largely, yes. The exact numbers might vary a bit depending on the region, the UK context mentioned in the notes, but the overall pattern is consistent. It's strongly linked to healthcare environments.
Which really drives home the point about infection control.
Absolutely. It highlights why things like hospital surveillance programs to track these infections and strict infection control practices, hand washing, sterilizing equipment, all of that are just so crucial.
Totally essential.
Yeah.
Okay, let's talk about the patient experience. If someone does have a Klebsiella infection, what might they actually notice? The clinical features, the signs and symptoms.
It really hinges on where the infection is located. Let's take Klebsiella pneumonia first. Remember, this often hits the upper lobes of the lungs.
Right.
Key symptoms: high fever, a cough that brings up sputum, chest pain, and often difficulty breathing, shortness of breath.
Okay. And there was that specific sputum type mentioned.
Yes, the red currant jelly sputum. It's not seen in every case, maybe not even most cases, but it's very characteristic when it does appear. Worth remembering.
Definitely memorable. And who tends to get this specific pneumonia?
Yeah, it's classically associated more with people with alcoholism and also those with diabetes. And it can sometimes happen after aspiration, accidentally inhaling something into the lungs.
Got it. Maybe a memory aid here, like a red cup, alcoholism, red currant sputum, upper lobe pneumonia.
Hey, that works. A red cup for Klebsiella pneumonia. Nice.
Okay, what about UTIs caused by Klebsiella?
Well, the symptoms there are pretty much your classic UTI symptoms. That feeling of urgency, needing to go right now, going more frequently, maybe pain or burning sensation during urination. And sometimes the urine might look cloudy or even have blood in it.
Standard UTI picture then. And if it goes systemic,
Yeah.
if it spreads.
If Klebsiella gets into the bloodstream, that can lead to sepsis. And the signs of sepsis are more body-wide: fever, chills, a really rapid heartbeat, confusion, or altered mental state. So yeah, the features really depend on the site.
Understood. So how do we confirm it is Klebsiella? What investigations are done?
The gold standard really is microbiological culture and sensitivity testing. Right.
You take a sample from where you suspect the infection is sputum if you suspect pneumonia, urine for a UTI, blood if you're worried about sepsis.
Yeah.
That sample goes to the lab.
And they try to grow the bacteria.
Exactly. They try to culture it. If Klebsiella grows, first, they identify it definitively.
Yeah.
And second, and this is absolutely critical because of the resistance issue we talked about, they test its sensitivity. Which antibiotics will actually kill this specific strain?
So it's not just what is it, but what kills it.
Precisely. That sensitivity report guides the treatment. Alongside cultures, imaging studies are often helpful too. Chest x-ray, or maybe a CT scan for pneumonia to see how widespread the infection is in the lungs.
Okay, so diagnosis confirmed, sensitivities pending or known. How do we manage it? What's the treatment approach?
Treatment really revolves around antimicrobial therapy, antibiotics.
Makes sense.
But the key is choosing the right antibiotic. That choice depends on, well, where the infection is, how severe it seems, and crucially, those sensitivity results.
So you don't just guess. Well, initially, you might have to make an educated guess. Often, doctors start with broad-spectrum antibiotics drugs that cover a wide range of likely bacteria while they're waiting for the lab results to come back.
Okay, like covering the bases.
Exactly. But then, once those sensitivity results are back, the treatment should be adjusted. You narrow it down to the most effective, targeted antibiotic for that specific Klebsiella strain, if possible. For severe infections, hospitalization is usually needed for IV antibiotics and supportive care, things like fluids, oxygen monitoring.
Right, tailoring the treatment is key. What about the outlook, the prognosis for someone with a Klebsiella infection?
It honestly varies quite a bit. Depends heavily on the site of infection, how severe it is, and importantly, the patient's overall health and any underlying conditions.
It's lots of factors.
Yes, but early diagnosis and getting the right treatment promptly definitely improves the chances of a good outcome. However, we have to be realistic. Severe infections, especially with those resistant strains, can lead to really serious complications. Things like septic shock, organ failure.
And the mortality rate mentioned in the notes.
Yeah, it's quite sobering. For severe cases, particularly bloodstream infections or pneumonia caused by resistant strains, the mortality rate can be unfortunately high, somewhere in the range of 30 to 50%.
Wow, that really underscores the danger, especially with resistance. What sort of complications can develop?
There are several potential complications. The infection can spread from its original site to other organs. Sepsis, as we mentioned, is a major life-threatening systemic complication.
Okay.
With pneumonia specifically, you might see complications like lung abscesses forming collections of pus in the lung.
Hmm.
UTIs can potentially spread upwards to cause kidney infections.
Right.
And then there's the ongoing issue, the sort of long-term complication for public health, which is the emergence of antibiotic resistance. Every time we treat, especially if not optimally, there's a risk of promoting more resistance.
That's a vicious cycle. Maybe another mnemonic could help here
Huh.
for complications, like SOPOU, sepsis, other organ spread, pneumonia complications, abscess, antibiotic resistance, and renal urinary tract spread.
SOPARU, yeah, I like that. Sepsis, organ spread, pneumonia issues, antibiotic resistance, renal involvement. That covers the main ones nicely.
Helps tie it together. So really, prompt treatment isn't just about recovery, it's about preventing these downstream problems too.
Absolutely. Prompt, appropriate treatment and robust infection prevention measures, particularly in healthcare settings, are our best strategies for reducing the risks associated with Klebsiella.
Well, this has been incredibly thorough. A proper deep dive into Klebsiella infections. We've
Right.
covered what it is, how you get it, who's at risk, how it works, how we diagnose and treat it. A lot of ground.
We have, and thinking about how common it is, especially in hospitals and care homes, it does leave you with a question, doesn't it? Yeah, maybe something for you, the listener, to ponder. Considering this prevalence in healthcare, what role do we all play, individuals, staff, institutions, in actually minimizing the risk, especially the risk of those infections that are resistant to treatment?
That's a really important question. Definitely food for thought. And if you want to delve deeper into this topic or tackle other key conditions for revision, make sure you check out pastmsra.com and freemsra.com.
Great resources.
Absolutely. Thanks for joining us for this deep dive.